Get off that couch and exercise.
Yeah, good.
I like to learn. Kids talk a lot.
We get things wrong sometimes, but we learn quick.
I'm Sophia. I'm Ethan.
I'm Riley. I'm Ricardo.
I'm Dr. Musa, interventional cardiologist at Trios. So I'm Dr. Musa, I'm a cardiologist at Trios. We engage in just treating people with heart disease. As you can see, there's a couple of hearts here. Does anybody know what the heart does? Yeah, let's start with you.
That it pumps your body and it makes you run and stuff.
So basically the heart essentially is a muscular pump, and does anybody know where it is? Yeah.
Like kind of like in your chest. Yeah.
It's kind of in the middle of the chest, and it points to the left. Let's look at a heart here. You see, there are three models of the heart, and I'll kind of point out to you exactly what the heart does, okay? So these are the hearts. This is somebody who's got a normal heart right here in the middle, and the heart is essentially muscular. You can tell that here's the muscle of the heart, and what you're looking at is these little red lines are the arteries in the heart, okay? The heart's got three big arteries. There's one on the top, one on the side, and one on the back side of the heart. So the heart is connected to the rest of the body with a number of what we call pipes. Essentially, that's what it is. And the red one here, as you can tell, is the aorta. So the heart squeezes the blood after it receives the blood from the lungs, which are really oxygenated, okay? Yeah. And it pumps the blood back out into the rest of the body, up through into the brain, arms, and to the legs. Okay, that's what it essentially does. And you see this little blue tube right here? So essentially the heart receives all of this blood, which is now what we call deoxygenated, okay? It pumps it back into the lungs to become oxygenated. It comes back into the heart, and the heart then in turn pumps it back out. So the heart has got four chambers here, okay? And the right side and the left side. You see this little blue tube here? Yeah. So the blood comes in on the right side. It goes through this little white structure here, which is one of the heart valves. So this side of the heart pumps the blood into the lung.
So is it like a bridge?
Yeah, it's essentially a bridge. So you have this little top chamber here, a bottom chamber there, and then the blood comes in, it gets squeezed out into this little purple tube here and into the lungs. The purpose of the lungs is to actually oxygenate the blood that comes in. Yeah. And then it pumps it back into the heart through here. See this little valve here?
Yeah.
And this is the main pumping chamber of the heart. This is the left side of the heart. You see it? Mm-hmm. This side of the heart then pumps it through this red tube here, which is the aorta. So when we say somebody has got a heart attack, what does that really mean? You want to try that?
Their heart pretty much stops beating.
That can happen. But in most cases, when we say somebody's having a heart attack, they're usually having chest tightness or pain, like really an elephant sitting on you, kind of squeezing you, you know, and that causes a lot of discomfort. You have pain going up into your jaw, your arms, and you can actually feel some numbness in your arms and your hands. You start sweating a lot, you really feel dizzy, sometimes you just pass out. So this is somebody who's had a heart attack, and when you look at this heart and you see this little spot here, can you see that spot right there?
Yeah.
Okay. What that means is that this artery here has become obstructed. The blood's not going down, okay? When that blood doesn't go down, this part of the heart muscle looks like that. It becomes purple and it starts to die, literally. Okay, so that heart muscle starts to die because there's no blood flow going down there. Any questions? Any things that you don't understand that I've said so far?
What's a plaque?
Good question. Plaque is really when you look inside the artery, you see this little yellow stuff on the outside?
Yeah.
That's what plaque looks like inside the artery. So when we cut open the artery, you can see this little yellow stuff that's growing inside the artery, just like this yellow stuff outside here. And that's what plaque is. And plaque can kind of grow and grow and grow, and then completely block the whole inside of the artery. That's what plaque is. Does anybody know what to do when you have an emergency? Go ahead.
Just call 911.
Very good, excellent. You call 911, and when EMS, which is the Emergency Medical Service, you see the 911, they would come to your house and they would put these electrodes, these little electrodes on your chest, and they would try to do an EKG, which is what I'm going to show you next, all right? And they would try to find out exactly what the electrical activity of the heart is doing. So the heart, when you open the heart inside, the heart has its own electrical activity. That's what actually makes the heart pump. So the heart has to receive some kind of signal to continue pumping, otherwise it would just stop and not work. That whole system is the electrical system of the heart that makes it pump, okay? So when we do an electrical activity of the heart, that is called an EKG. This is what an EKG looks like. At each beat here, you can see the heart is actually squeezing, and then it relaxes and squeezes again. You see what I'm talking about here? And these, you can see 1 and 2 and 3 and so forth. These are the electrical leads that are placed in various parts of the chest to measure the electrical activity of the heart. You see that? For example, if you're having a heart attack, we can tell on that you actually are having a heart attack. Okay? And then we can actually appropriately treat this. In most cases, we would actually do a procedure called heart angiogram directly from an artery here in the arm or in the groin, and thread this little tube and this little wire which would go all the way up through this aorta, this red tube here, and we can actually go into the artery and try to open that little blockage that's causing this heart attack here, and reverse the blockage and get that heart to pump better. You know, kind of like removing the blockage with a balloon and a stent. And it actually would inflate kind of like this. You know, most balloons inflate this way. Well, the heart balloon doesn't inflate like circular. It's going to inflate almost like this. And maybe get rid of that blockage. We can actually even have something go down there and it suck this clot out that's causing this person's heart attack. And then we would try to leave it open with a metal stent, which is really like a scaffold. Can you see the difference between these three hearts? Go ahead.
It's big.
Yeah, very good. Excellent. It's really big. And so you're right. We do see big hearts. And that's usually a sign that somebody's heart is, in a way, it's kind of swollen. It's big. It's enlarged. And that patient sometimes may have a condition called heart failure. And this heart is not responding very well. So the heart, it becomes enlarged and it becomes very, very sluggish. So if you look at the heart that's just pumping very slowly, can you imagine a heart that pumps very slowly?
It
It
looks
makes
like
it harder to breathe.
Exactly. It makes it harder to breathe. You'd have fluid build up in your lungs. You'd be short of breath. You'd have your legs start to swell up. And that's exactly right. You can see this heart looks very big. And so what happens next? You might find little clots that form in the heart like that. You see this little purple thing in here? That's what can form in somebody who's got a big enlarged heart. Let's talk a little bit about what can you do to prevent all of this from happening. Does anybody know?
You can obviously eat healthier and
Great.
do more exercising.
Right. So what does healthy eating mean?
Not eating too much junk food like chips and ice cream and
Moderation is the key, is what you're really saying. There's fruit, there's vegetables, and when you tell them that, you say, oh, gee, that's kind of boring. Is that really boring? Is that boring?
I like fruits.
You like fruits, great.
Yeah.
That's terrific. But there are other options, there are healthy options. And one thing you have to be sure that you have to know about is that a lot of this stuff has a lot of salt. So it's not just the fat and the fried stuff, it has all kinds of other stuff that's really bad for you. There might be chemical additives that you might be allergic to, there might be food coloring, there might be salt, all kinds of stuff. Really watching your diet and being more active is really more important than anything else, okay? So what is a symptom of a heart attack?
Well, they would feel dizzy, like just automatically shut down.
They could, but what is the main thing that they would be complaining of?
Yeah, they'd feel like an elephant just like,
Sitting on them, right?
yeah.
Okay, very good. And lastly, how would you guys treat somebody with a heart attack?
Get off that couch and exercise.
Good, very good. That'll be to prevent it, but how do we actually treat it? Remember I said something about trying to fix it with what? What do we do with that artery?
It was
Yeah.
The air balloons, something like that. The
Balloons, yeah. We try to open it up with a balloon. Very good. And we try to put something in it to keep it from having more plaque deposits in it. So when we look at people who have heart attacks, and remember I said that there's a lot of people who have heart attacks every day, every 26 seconds somebody's having a heart attack.
Wow.
Somebody's actually dying from a heart attack. So really it is a huge problem. That's why we need to address this and make sure that all these risks that we talk about, smoking and diabetes and cholesterol and not taking your medicines and being active, are addressed. We have to tell people all the time, this is really important for everybody's health to be active. And really, when you try to prevent something, it's a whole lot better than actually getting the treatment done on you. So that would be the important thing to consider. And when you do have a heart attack, the most important thing to remember is to try to get help as soon as possible. So the sooner that's addressed, the quicker we can open up that artery, the better it is for that patient's long-term outlook. Okay?
Okay.
Very good. Awesome. You guys are terrific. All right. Wonderful.